Hi, this is Dr. Jean-Paul Romes over at Pocono Urgent Care. Many times in the past, especially if you've come in and seen me as a patient, I've discussed the fact of antibiotic use and overuse in the United States. It is a common knowledge amongst the medical providers. That's something they teach us in medical school, and about the studies that show that in the United States, antibiotics are overprescribed almost 60% of the time. That means you don't need them, but then they're still prescribed for you. Very commonly, people walk into clinics, and there's many reasons why they come in for different ailments, and there's many reasons why the providers may or may not give you medications as a result of those complaints. One of the problems is that when people come in for common viral infections, coughs, runny nose, sore throats, sinus congestion, ear infections, vomiting, diarrhea, many times the providers prescribe them antibiotics. And unfortunately, most of the time, as we've discovered in that 60% of antibiotics are unnecessary, most of the time patients receive the antibiotics, but they don't need them. Now, of course, with coughs and colds and flus and runny noses, we all get better, at least the vast majority of us. And we get better in, on average, about 1 to 2 weeks. When somebody prescribes you with a week's worth of antibiotics or 10 days worth of antibiotics, of course you're going to get better, but you're going to get better despite the antibiotics, not because of the antibiotics. The problem is that the antibiotics can also have an adverse effect upon you, which means a bad reaction, whether that reaction is nausea or vomiting or yeast infections or diarrhea, or in some cases, as has been recently on the news, predispose you to unusual arrhythmias of your heart and heart problems, which could eventually end in your death. Many, 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 many bad side effects can occur from antibiotics. And if you don't need those antibiotics, and most of the time you don't need those antibiotics, if you don't need them, then why suffer the possible consequences of the bad side effects of antibiotics? As an emergency physician, I have seen countless people come into the emergency department very ill, not because of the illness, but because of the antibiotic side effects, whether that be horrible rashes, very severe allergic reactions, severe diarrhea, infections such as Clostridium difficile, which causes a severe diarrhea, which could also kill you, and many, many other adverse reactions from antibiotics. And most of the time I've found, as have many researchers, found that those antibiotics weren't needed in the first place. Antibiotics are especially overprescribed in children. Whenever 3 children come into the clinic, all with similar symptoms, and all walk out with antibiotics, well, in my mind, that's ridiculous. Because the vast majority of times, those are all viral infections. That's why little Jimmy, little Susie, and little Bobby are all sick, because they're spreading a virus around amongst them. They don't need antibiotics. They need time. They need some medications to help them feel better, or help them cough less, or help their temperature come down, but they don't need antibiotics. They just need time to get better, and lots of fluids, by the way. So unfortunately, it's easier to describe, or rather than describe why they don't need antibiotics, which takes time and education of the family and the patients, it's often easier to just prescribe antibiotics. It takes the average provider less than 30 seconds to write a prescription, and therefore they can get the patient in and out of the door in less than 3 to 4 minutes. And if they're seeing a lot of people that day, that's easier. But unfortunately, that's not better medicine. It's easier medicine. I've found throughout my career that spending more time in describing why they're sick and how they're sick and what medications can help them feel better, but that antibiotics won't cure them, I find that even though that takes more time, it helps the patient out in the long run, because they have less resistance, less bad side effects, and they still get better, and they also will know more why they are sick, and also they get medications from me that make them feel better. Cough medicines, recommendations on decongestants and antihistamines, anti-diarrhea medications, but not antibiotics, which are often unnecessary. So one thing that you want to find out from your physician whenever you go to see them for illness is, do I really need those antibiotics? And if you find a good solid answer and a good confident answer, that's terrific. But often is the case, you may not, and you may just get antibiotics. In that case, you want to sort of raise your eyebrow and go, do I really need these medications? So, if you ever have any questions, come on into Pocono Urgent Care. We're happy to help you out. Or you can just call your physician and find out from them if they give you a good answer. So you have a good day, and thank you very much.